Hello and welcome to Relatively Ordinary. I am Carl.
And I'm Betsy.
Welcome back.
Welcome back.
To Relatively
It's been
Ordinary
a little bit.
Worldwide headquarters.
Right here.
Right
in
here.
our very own bonus
In
room.
our secret
Who knew?
lair. It's a secret lair. Don't tell them what it is. It's a secret lair.
Yeah, but it's the first window you see when you come up our driveway. Okay.
It's a secret.
Okay.
How are you?
I'm overworked and tired.
Mm-hmm.
Yep.
Yeah.
That's pretty much it.
Yeah, we're a little bit behind on getting this episode out there. Last weekend you were traveling.
Yep. I was in Kansas City, Missouri. I originally thought maybe I was going to St. Louis.
Yes, you did.
That's how organized I was for my trip.
You made it to the right state, though. So
I did. Yeah.
It's good.
Well, and I ended up making it to the right city. A very pretty city. I enjoyed it.
Yeah.
A lot warmer than it was
good
here.
Weather.
I enjoyed that. Very nice people, good food.
Mm-hmm.
But yeah, I was there for a professional conference, so
Yeah.
I wasn't there as a tourist.
And you survived the
less fun.
Antifa riots.
Yes.
Thank God.
Oh, God. It was
Thank
a close.
goodness.
It was a close call.
Yeah.
Not at all.
Yeah.
It was very calm. It's a beautiful sunny day.
Yep.
If anything made the city hustle and bustle, it was the marathon that happened that day, and just tourists out and about, but pretty mellow things going on.
Yeah.
Very healthy. What I would say was appropriate protesting happening across the country.
A healthy expression of our First Amendment rights.
Exactly.
Yep.
Yeah, everyone's staying safe.
Yep.
And standing up for themselves.
Yeah. God bless America.
Yep. Yeah. So yes, I'm just very busy at work. Very busy. And I need to catch up on some sleep. October is a very crazy month. So, but I'm feeling pretty jazzed right now because I was able to successfully help our son with homework.
Yes.
Math homework.
Math
at that.
homework. Yep.
Wow.
That's pretty rad.
I've never been able to say that before.
Yep.
So that feels good. Got a little pride there.
Nice work, Professor.
Yeah. All my stats classes. It only took 3 stats classes to feel this confident to help with high school stats. But
yeah.
Yeah. How about you? How you doing?
I'm hanging in there. Had a pretty good week. Body's feeling good. Getting good sleep.
Good.
Work's going good.
Yeah.
So yeah.
Nice.
Feeling good.
I graduated from PT.
That's
feels
right.
good.
Yeah.
Yep. My body is now feeling not as old
Yeah.
and worn out.
You don't look a day over 41.
Yeah. I am though. Shh. But then, I've graduated, so I'm feeling good. Gonna keep doing my things,
Nice.
and then I'll probably be back in a year. But that's okay.
Yeah, with some other grievance.
Yes.
Yeah.
Some other injury.
Yeah.
Yeah. So I've got the fun question.
Let's hear it.
Okay. So I want you to think of a time, likely in your high school or middle school time period, and you might need to sit and think about this for a moment. So I'll say the question first, and then I'll give a little background around why I even thought of this. But something embarrassing that happened to you that you're, willing to admit now, just for, maybe comedic relief, but also just to, air, get it off your chest, grow from it. But I'm thinking about it because our daughter talks about all the things that are so embarrassing that really aren't that embarrassing, but it is a time where you're very self-conscious and, putting yourself out in the world feels very vulnerable, even though it's a small social circle. You're going to have to be with these people for years.
Yeah.
So, the social hierarchy makes it challenging to do anything that's embarrassing, or it all feels embarrassing, even though it's just part of growing up. So have you thought of something? Or I could keep rambling.
Yeah, no, I
okay,
got
you had something immediately.
Yeah,
there's something trapped in there. You probably shared it with me.
I don't know if I've told you this one.
Okay.
I don't know. But my freshman year of high school.
And you were a little freshman. Meaning like you developed late. I'm setting the scene.
I was the youngest. I don't know if it's relevant to the story. Maybe it is. I don't know. But I was the youngest kid in my grade, and I was like tiny.
Would you say you were kind of the runt?
Well, I mean,
you didn't act like it, but
no, but I did act like kind of an asshole. Like I was pretty, I was a little scrappy.
What character in The Sandlot would you have been?
I don't know if there was a character. Probably more like Bad News Bears because I'd run my mouth like when I shouldn't run my mouth. And, but there was a girl who I was friends with, and we flirted a lot. And I kind of liked her, and I think she kind of liked me, but I didn't know how to navigate it. And she was sweet. She was smart. She was nice. She was really cute. She had a lot going for her. And I was a doofus, but she liked me for some reason. And there was one time
I like you too, and you're still a doofus.
Yeah, but I've progressed a little bit from 13, 14 years old.
You're an adult doofus.
Yeah,
that's it.
But she took. I had a nice Red Sox hat, just like our son likes to wear. I had that was like my pride and joy. And also it was kind of a dumbass thing, but I was going to Catholic school at the time, and if you were on school grounds wearing a hat other than it was part of your baseball uniform, you're on the baseball team or something like that, that was immediate grounds for detention. So we like to try to wear.
You'd have to go and confess your sins.
We try to wear hats as much as possible, but you throw the hat on and then the teacher's coming around the corner and you
Whip
hide it, that sort of thing, because that was the way you were cool and you were a rebel. And anyway, we're hanging out after school. There's a bunch of kids around, and she grabbed the hat off my head and put it on and started to run away, which is just classic flirty thing. And I basically tackled her. And it was
full on contact
it was just
tackle.
It was it was a sort of a natural big brother reaction to teasing little sister, but I physically overreacted, and it wasn't I hurt her or anything, but it was just sort of
Did you grope her?
No, it wasn't, and it wasn't that. It was I was trying to get my hat back, and I was annoyed that she took it, and I just reacted, and I smothered and tackled her, and
to the ground.
And she was what the fuck are you doing? It was
Did the relationship stop there?
No, but I think it was for me, I knew right away that I was that was so dumb, dude. It was just not, it's if that was a dude, you'd just be okay, we're horsing around, but that was just not appropriate, right? And fortunately I didn't hurt her or anything, but it was so embarrassing. And I saw all the other people that were there were what the hell is wrong with, it just was so dumb,
too much.
And I felt so bad, and so I couldn't even look her in the eye for weeks after that.
Did you ever apologize?
I think I did, but I also didn't, I literally couldn't look her in the eye, so I couldn't even be Kristen, I'm so sorry.
You remember her name too.
Yeah. So Kristen Colaccio, if you're out there, I'm sorry. I'm really sorry.
It's gonna mean a lot to her.
Yeah.
And he's still a doofus, Kristen, just so you know.
Yeah, but she was great, and I really screwed that up.
Yeah. Oh, missed opportunity. And then you didn't have a date for 5 more years. I'm joking.
Yeah. No.
Did that hurt your feelings?
Yeah, no, it was right up until I met you. Yeah. A lot of strikeouts. Yeah. So that was
probably stood out.
Yeah.
Oh, you're still reeling. Sorry I made you relive that, but hopefully now that you've processed it, you're feeling a little unburdened.
You just got to deal with the cringy stuff that you do over time.
Lots of cringy stuff.
Yeah. Right on. Well, do you have anything you want to share in that regard?
Oh, there's probably so many, but one that stood out is I had a math teacher who was a pretty young new teacher in our district.
Fresh meat,
yes. And so endearing. I think of him now, if I could think of him as an adult peer, a very endearing guy, did his best, really put students first, was quite dedicated. I think he wasn't, you think pretty young, so not married, no children, blah, blah, blah. And I just remember, I don't, this is where the memories are vague a little bit, but I remember there were some rumors going around. This is where the era where you'd pass notes, so no cell phones.
Yeah.
You'd even fold the paper.
No WhatsApp. Or
you'd fold the paper
Snapchat.
into, the little triangle and you'd pass it to your friend kind of thing. And I think there was a note passing around that we were talking about how cute this teacher was, and like how we had a crush on him, blah, blah, blah. And somehow he got a hold of it, and you could tell. I think I remember there was a moment where I think he came across it and read it, which, by the way, if you're ever a teacher, do not read the notes that are sent between students. Just stay out of it. It wasn't meant for adult eyes. But I think he figured the information out and knew that I was one of the girls talking about it. I personally don't remember being like, oh, this guy's cute, but whatever. And just totally red in the face, blushing hardcore, embarrassed, awkward. He just started acting awkward. And I was like, oh, this sucks. So it was a group embarrassment kind of situation.
Mutual embarrassment.
A mutual embarrassment.
Yes.
And one of those things I'm like, let's not do that again. But yeah, passing the notes. Wow. That was a thing.
We had when I was in eighth grade, we had a brand new teacher, like first year teaching, and he was our math teacher. And this was like one of those classrooms that was like, is it a classroom or is it a jail? I don't know. Like it was
because of the
wild.
teacher's behavior?
No, because of the students' behavior.
Oh.
And that poor guy was just eaten alive.
Oh, yeah. There's one in every building.
Oh, man, that poor guy. But, yeah. Anyway, I was not part of that. You
weren't a hoodlum?
No, I was good. I was well behaved in
doubt it.
that class, and I took care of my teacher. But
you're
everyone else,
empathetic.
Yeah.
You were only an asshole to those who were keeping the peace in most classrooms. Is that what you're saying?
No, I mean, there was method to my madness.
Okay.
Anyway, let's get to our topic.
All right.
So today, I want to talk about health and wellness.
Oh, that's my jam.
And I know that's
We're
your jam.
going to go on and on and on. Do we
jam.
have enough time?
And I actually really, I'm excited to hear kind of, from multiple layers of your personality, how you think about this topic. So
I got to say all the right things too. I'm going to be so critical, I might just shut down.
Yeah, don't do that. That's bad TV.
Okay.
All right. So we're going to talk about what does being healthy actually mean?
Oh my gosh.
And how do we achieve it?
Ooh.
So today we're seemingly obsessed with health and wellness. We're bombarded with advertising promising products and services that will make us fitter, healthier versions of ourselves. We have supplements, diets, technology solutions for any wellness goal we can imagine. Some of it represents heightened achievements of modern medicine, and some of it is just pure bullshit.
Yep.
So first question is,
uncontrolled
and thinking
pure
about
bullshit.
the perspective of just the average American, right? Whatever that means.
Yeah.
What are we getting right and wrong about health and wellness today?
Okay. What are we getting right and wrong? And so we're thinking average American. Are we thinking now this is our way zoomed out thinking nationally, globally?
Whatever you want.
All right. Well, I actually had a part in the curriculum because I'm teaching a class related to health. And what comes to mind is that I don't think we really have a good sense of average. I think what we get bombarded in, meaning you and me, people who have social power because we have health and we have resources such as money. We're white cisgender people. We are native English speakers living in America. America has a lot of resources. Yes, we are bombarded with a lot of advertisements, and we'll talk about that later. So I'll table that. But I think what we truly need to understand about average America is that there are a lot of health inequities. We know a lot more about social determinants of health, which I'm sure you've heard a little bit about that.
Yeah, of course.
And
I am married to you.
okay. I was like, oh, are you faking it? And that the average American is put in a really hard position in order to attain health in the way that we really need to be healthy. We think of the basics, right? Having the time and the resources to be able to get sufficient sleep, in order to, eat a healthy diet, in order to get the right amount of exercise, be able to go to well-check visits. If we need medications, being able to afford them, to take them on a regular basis. Thinking about the different lines of prevention and accessing that and making sure it's affordable. And I think there's a lot of hardship out there. So, bring me back to your question again.
Well, what are we getting right and what are we getting wrong?
Yes. So that's highlighting a lot of what we're getting wrong. I think what we're getting wrong is that I think any healthcare provider would probably say this, that we're trying to tackle disease once it's started, and we don't prioritize, because there's not a lot of sexy money in it, prevention. And the money that is available for it is not what the average American needs. I'm thinking about, our standard health insurance model. We want people to see their primary care provider. We want them to get the resources they need. But I'm really thinking about the upstream public health initiatives where we are able to support, whether it's from the government or local infrastructure, starting from a really young age, being able to provide the resources and education to have the disease prevention. So I think we're getting that wrong, because we're very reactive, and we think about health span versus lifespan. Having that health span requires that upstream prevention. I think what we're getting right is that to date, I don't know if it's going to continue this way because of what's been happening in our government as far as funding research initiatives and public health initiatives, and having a fully supported department of health, and just looking at those pieces. But the piece I think we're getting right is that to date we've had a lot of great research that has highlighted important variables about the genomics of how we can address genetic conditions, but also doing full genome sequencing so we can better predict and prevent disease. I also think that we have, while not always affordable, we have better medications to manage diseases. We have a lot more knowledge about what we really should be putting in our diets, and what we should be doing as far as physical activity. We have the knowledge. It's the behavior change, and it's being able to support individuals to do that. And circling back to the social determinants of health, I think those are often the biggest barriers and create a lot of health inequities. So it's not an even playing field. I know I could go on and on and on, and I have already just blabbed, but I think that was great. There's some right in there, but there's a lot of wrong things that make it hard.
I saw a very interesting thing yesterday. I saw an article, and I didn't really take note of where it was and where the research had come from, but basically there was research that came out about peanut allergies, and it was a study that was saying that they're actually seeing a reduction in peanut allergies because of advice that actually the advice had shifted towards actually expose your kid to foods they might have an allergy to. Mm-hmm. And so they think that has actually exposing kids to allergens, potential allergens, has allowed them to obviously identify nope, this is an allergy and we need to be very careful and manage this, but also kids who might have developed an allergy didn't because they were exposed to it
Mm-hmm.
at an earlier age. And I thought that was like, in all of the bombardment of like bad health related news that we're getting in the world, and just outright crazy shit that comes from, JFK Jr. or RFK Jr.
I was going to say RFK.
Yeah.
Yeah, and just pointing the finger at the wrong things.
Yeah.
I don't even want to go. I don't even want to give that any more attention.
Yeah, we're not talking about.
But I would say,
today.
and there's been a lot of interesting stuff come about. As we understand. My latest deep dive has been in the gut microbiome and understanding inflammatory diseases, and also thinking about my area of interest and practice is in, infancy, childhood, adolescence, and how, knowledge is power and practice is power, and how it really does need to be public health initiatives to really start building these behaviors from a young age and then having them develop. But we know that they say that social determinants of health determine 80% of health outcomes, that medical care is only 20%. So you can't ignore that, despite best efforts, there may be significant barriers. And
so give me just one specific example of what you're talking about when you talk about social determinants of health.
Yeah.
'Cause that's super interesting. I think I understand what you're saying. 80% comes from social determinants of health. Mm-hmm. But give me an example.
Yeah. So I'll give you an example. Someone, comes to, see me because they're dealing with low back pain, right? And they, as you dig in, it's not like you coming to me with low back pain. You are well educated.
I've been sitting on my butt too long.
You're well educated. You're gainfully employed. You have positive health habits. You have a clean health history. You have high health literacy. You are an easy patient, right? Like, we know how to handle that. But counter that with someone who, maybe doesn't have health insurance or is underinsured. So they only go to see the doctor when it's an emergency. It means, visiting the ED. You're managing that the best you can because that person might not be able to access follow-up care, but somehow they came to physical therapy. And now you're looking at, okay, how are they going to afford this? So my traditional plan of care may need to be modified. We also find that, you have, maybe if you're underinsured, you might also be underemployed, and finances are tight. So prioritizing your health and other means by, eating a healthy diet, being able to even access that food depending on the environment you live in. We think about situations where someone may, be dealing with stress and variables because of those structural situations, and so it just compounds things. And we know that those are playing a more significant factor in, hey, let me just treat your mechanical low back pain, right? Mm-hmm. Like, I'm going to give you things, but what can you walk away with? Mm-hmm. And so it's addressing that holistic picture, and you can't always address those things in a silo. That's why it's important to have interprofessional care and blah, blah, blah. I could go on and on, but that paints hopefully a good picture. And no one patient is easy, right? Everyone has some complexities to it, but that just makes it so much harder to really address health. And what happens is it's a vicious cycle. So that person, maybe also dealing with other comorbidities, and, they need to prioritize treating their diabetes rather than their low back pain. And those medications are expensive. And, it just becomes a cycle. And then their low back pain leads to them missing work because they're dealing with pain. You see where I'm going with this.
Yep. Totally makes sense. Okay. So let's move to community. And so I want to hear your perspective as a healthcare provider and as a member of the community of healthcare providers. So, as a healthcare worker and healthcare workers in general, are you set up with the system, structures, and incentives you need to help people live healthier lives? How do you feel the community of healthcare workers feels about the state of health and wellness today?
I think we can get disparaged if I answer that first. But it's a unique breed who work in healthcare and in certain roles. So if I go back to your first question, the systems, like what systems are in place. I think the systems, as far as how we think about maybe a patient going through the system and getting the care they need, is actually well designed. I think the challenge is the economics of it. And then also thinking about equity, right? So it might not be a great system for all people. We have areas within our own state, but certainly across the country, where there is a lack of healthcare resources. So those systems that you might see in a major metropolitan area are not there, or cumbersome for someone to get to. But when we think about, you go see your primary provider once a year, you go see your specialist if you need it, you go to the hospital if you're having an emergency, you go to rehab if you need some longer term care that's more intensive. Like I think those models match the evidence that we have. What I think, what was after systems? It's a lot for me to process those questions. I need to see them written down.
The systems, structures, and incentives.
Okay. So, I talked a little bit about systems and structure. It's interesting because in my field, and you see it in some other similar fields, people who are skilled, who have lots of experience and can offer patients a better opportunity to address their needs, are leaving the insurance model. The insurance companies are out for the insurance companies. They make it difficult at best to do your job. And I don't want to serve the insurance company. I want to treat to serve the patient. And what I find is that, and I do that somewhat myself as a provider. But, again, health inequity is there. But if I was a very skilled provider and I felt like this system is cumbersome, it's putting a lot of strain on my practice, it's not allowing me to treat in the way that I want to because they're only going to reimburse certain things, or time is money and I've just got to go, it's going to compromise care. It's going to compromise your integrity. And you go into this field because you want to help people, not because you want to deal with paperwork and administrative work to please the insurance company. So what you do is you create a system that works for you as a provider so that you avoid burnout, that you get paid better, and that you have ultimately a better connection with serving your patients and doing the work that you want to do without the boundaries of what an insurance company will say you can do. And if I think about the last part of it, system structure and then incentives, it relates to that. I think the greatest incentive for most healthcare providers is doing a good job. For me personally, there's nothing that makes me feel more inspired about a situation when I can truly help someone. That my knowledge or my skill set or what I can bring together with my team of, people who are not my team, but the team who's helping that particular patient feels really rewarding, right? And that's what you want to do.
It's very noble of you.
It's not about being noble.
I do take so much pride and intrinsic enjoyment out of a job well done that is well compensated.
Yes. Well, it's compensated enough. Certainly I'm at an age where I don't take that for granted. I'm trying to, or at least maybe that's not the right way to put it. I'm looking down at like, okay, I need to be prepared to retire. I do want to retire. Yeah. I need to make enough money that I can pay the bills and I work hard, right? What does that mean? I don't know. I honestly feel like there's inequities in pay structure, and part of it is based on liability, but I don't think it necessarily relates to the type of work that one is doing, and also how hard your lobbyists are working. Let's be honest. Yeah. Like I'm learning a lot about that.
But PTs need better lobbyists.
Yes. But I think there are incentives that are outside of just the financial, but the financial incentives are well enough, right? So.
Yeah.
feel
So
good about it.
do you think, like, again, kind of thinking about your peers and, other types of healthcare workers you work with in your field, I mean, do people feel good about our healthcare system? Is it sort of like, yeah, it could be better, but we're doing the best we can? Or like, how do you think people feel?
I think people are getting creative and thinking about providing good health care in mind, right? So we've got some businesses that, do consulting on the side, or do, group education sessions, or have, a multimedia presence for their brand. So again, that's if you're more of a private practice type thing. I think what I'm seeing, this is interesting because I had the whole cycle of providers. So I have seen probably in the past 5 years as many primary providers change for me. So I have, I started with one NP, they got burned out and left. And then I got another nurse practitioner and they, moved to a different area. And then I've got a PA who decided they didn't want to be in family practice before I even saw them. Like it's laughable. And I don't blame them, but it's broken, right? This was unheard of during our parents' era, and we're also seeing that these small practices are now being swallowed up by these big healthcare agencies and organizations because it's the only way you can make it financially stable and sustainable and have the resources to pay your employees and to have the benefits and to see the volume of patients that are coming through. But it leads to burnout and people are dissatisfied. I wouldn't want to work in that kind of, it feels like a factory, right? Yeah. And, my mom and sister are nurse practitioners. They work in an area, a niche that I think they really enjoy, but they have seen these systems firsthand, and it doesn't feel good to be told like, oh, increase your billing units and we're going to audit this because you're not doing X, Y, and Z, and you need to have this happen.
Yeah, that's when to get the bean counters involved.
Yes. So I think yes and no. I think those who are really excited about the job they do and can find their niche, or maybe just kind of cycle around, are pretty satisfied. Those who are really well compensated, like, why would you get out of it? A lot of physicians are in that position, and maybe you feel like you're stuck because you've got to pay school loans. But yeah, I don't know. It's probably more individual, but I see a wide range. I think as far as PTs, what I've discussed is probably par for the course.
Yeah. And so I think, and I'll use this to kind of transition into,
Well, before we do, I'm actually kind of curious for you to share your experience, which I know you're pretty jaded about the healthcare system, but as someone who's not a healthcare provider, but you take this perspective of someone who's a consumer.
We can I'll answer that question, but we'll kind of transition into talking about more at like, the personal level, the family level.
Yeah.
What are the things that you see as priorities in healthcare for yourself and for your family?
Yeah.
And what I think is interesting, you touched on it, is, I have personally, in the last few years, now most of my life, I've always been fairly healthy. I have a few sort of like, nagging, chronic, annoying things, that I take prescriptions for or have treatments for, but like none of them are like, I'm not going to die if I don't get my prescription.
You're well managed. Yes.
Everything is under control. But, my experience is kind of what you describe of like going to, a primary care doctor and having them not know me because they've churned from the last time, and, really like answering the same questions over again, sometimes dealing with like, and I'm going to say it, like I've had times when I've had to deal with bias, right? Like where I can tell the doctor is like, I don't believe you because you're a young man, like, and that's coming from like being a straight white dude, right? So imagine if you're someone who has more,
health inequities are amplified when, you're
right. But all of this to say is like what I've gotten to a point in my life where I'm like, you know what, I am going to take some amount of my income and dedicate it to taking care of myself in the way that I want to. And so there's a few supplements that I've taken that I have, been effective for me.
Mushrooms?
There's
that came across.
Yes, doing some psilocybin. No, that is not the supplement we're talking about.
No. But there are other mushrooms that are good.
Yeah.
Adaptogens.
And so I do pay out of pocket for certain, healthcare things. I'm like, I don't want to deal with insurance. Like my insurance is, I have a good insurance plan and it's there for me if I need it.
Yeah.
But like, it also forces me to go to some of these like, frankly, like factory floor medical clinics where it's like, they don't know me and they put me on a conveyor belt and poke holes in me and I don't like it. So, but what this is really like me with a lot of privilege and a modest amount of wealth being able to say, screw this, I'm opting out of the, more mechanized system.
Well, you are investing in your future health too. So you're making a wise investment, which you're capable of doing. I think that's what people need to appreciate.
Absolutely. And I think it's, to be clear, I think that like everybody should have, like, if you do have some money, like you should be able to do it.
Yes.
Like, you should have more discretion over like, I don't want to see it, us in the attempt of like trying to serve everyone's needs, we make everything mediocre and then everyone gets mediocre care. Like, I think you should be able to, go pay more to get better care for things.
Yeah.
But I also think that like the baseline level of care for someone who like, has a good steady job with the good steady insurance plan. And I don't think it's not the fault of the practitioners. It's more of the system that's set up with this, insurance and everything else is not good.
Well, what I'd say if we're thinking about individual and health, I'm going to pivot a little bit because.
Yeah. Well, we can get back to my original question, not just ranting too.
Oh, okay. Well, I can stay on the rant. I can stay on the rant. If I go back to the original question, one thing that I think we're doing well, I'm going to like circle back to what we were talking about at the beginning, but one thing I think we're doing well is being creative about health insurance models. So the HSA, right? The health savings account. I think that's great. So then
HSA is good.
It's less controlling for the individual, and then we can make these choices for ourselves for how we use that, and it can be from this preventative lens, or primary prevention lens. I definitely have leaned into some of the, thinking things that are above and beyond, just the standard of care for prevention. So I think about, supplements, but also it can be individualized. Like I invested some money into our home gym, and you have been able to, think about, all right, I'm gonna, get some of the, what's the word for it?
I can't help you unless you give me something more.
I know. Well, we'll skip that. We'll skip that for now. I think I'm starting to fade right now. But essentially, what I'm doing is, some insurance doesn't cover certain things, but we know it's related to health and wellness. So yes, leaning into that, listening to the podcast, reading up on some of the latest, greatest research, leaning into some of the trends, trying them out myself.
Okay. Is there a podcast or trend you can
don't ask
recommend?
me to name names. Well, I do like the Body Pod. Those ladies are pretty amazing.
Yeah.
And if you're a menopausal woman or perimenopausal woman,
and I'm not.
Great research. Nope, you probably wouldn't like it. Well, actually, you might find it interesting because there's some good things that I think transcend just women, but people in our age bracket. So I don't know. It's interesting, and I think a lot of those elements too, while they might be trendy, I don't think they're all the answer. Right? I'm definitely a fan of rigorous research before you jump on the bandwagon and do crazy things. Like, I don't think I'd really ever want to try microdosing.
GLP-1.
Yeah, GLP-1.
Oh, really? Because
yeah,
I'm all about it.
You're all about it.
Sign
You were
me up.
mentioning that the other
Sign
day.
me up.
I'm like, that's crazy.
Yep.
Well, it's really for people to lose a significant amount of weight. Well, even then, like, I would consider
It's not.
15 to 20 pounds. I don't think you would need to lose 15 to 20 pounds.
Yeah, I don't know.
Gosh. Like, if I lost 15, 20 pounds, I'd be like a 12-year-old again. That's how much I weighed when I was 12.
Yeah, I mean, you don't need to lose 15, 20 pounds.
Well, I thought it was something you're like, oh, I think everyone needs this.
No, but I think, a topic for another day, but what I've read about it, first of all, is there are a lot of people who are like microdosing and with great effect. And one of the biggest things is it's just like
an appetite suppressant.
It helps in the appetite suppressant thing is because I'm this guy, like I'm not really overweight and I haven't really had a problem with weight too much in my life, but I'm like a compulsive snacker. Like if I get like bored, anxious, like what do I do next?
That just requires some behavior
I
change.
go into or a drug that just...
Yes, but drugs have side effects. This
Sure.
is a thing.
Sure, but you know what else has side effects?
What?
Is me
snacking.
eating Girl Scout cookies and peanut butter.
Ew,
So,
you do that?
I mean, what,
Oh my God.
who doesn't?
You shit on Girl Scout cookies all the time. And here, everyone's
are-
out of the house. You
if you
sneak
put-
over
if you
and
put
you just
peanut
dip
butter on them.
one of those Thin Mints into...
Yeah.
Dang,
Yeah.
bro.
No, and I'm pretty good.
Did you do that today?
I did do that today.
Oh,
which is-
geez,
And let me tell you, it was delicious.
Oh, don't do that.
It
Don't
was
do
those
that.
those like shortbread ones.
Oh,
They just been sitting in the pantry looking at me that whole
they're
sleeve. And they're
stale
like,
as shit.
put peanut butter on me.
Gross.
And it
I
was
should
so
have just
good.
tossed
So
them
good.
last time I saw them. I was thinking about it. Yeah. Okay. Microdosing, GLP-1s aside. That's the type of trend stuff that I'm like, okay. Fair enough. I want to learn more about it. The protein craze, the gut microbiome, let's low muscle overload, and we're gonna walk 10,000 steps a day, and we're gonna
With a weighted vest.
Like I'll lean in and learn about all the things, but I think what's hard is if you don't have the health literacy and you're not going to dig into the research yourself, you should be careful. Right? Don't put all the eggs in one basket. We have seen a lot of health trends crash and burn. Remember Olean? Wasn't that? Yeah. That like it changed.
That wasn't really a health trend as much as that was
a marketing trend.
Yeah, it was a
making something shitty even worse for you.
Food that was made
but it led to the runs, right?
Yeah.
I was telling our daughter about that recently. Yeah, she's like, "What? That's disgusting."
Yeah.
It also was followed by a discussion about how when my mom was first a nurse, they used to have the doctors and nurses would always take smoking breaks, and they sold cigarettes right on the hospital floors.
Yeah.
So
Wild.
we have learned a lot.
Wild.
We have learned a lot in a short time. So yeah, I'm a little leery of trends, but I lean into some of the hype and just so that I can learn more, discover more. But I'm definitely like, show me the research. When I think about our kids, because I am not, aggressively controlling about their health, but I try to, slow ideas like, hey, here are my opinions. This is what, I know. This is what I learned. Is it corroborated by what they're learning in health class and from their peers and their coaches and you and blah, blah, blah. And, letting them explore. Our boy child does not eat many vegetables. Does that make me happy? No. But he knows that vegetables are healthy. He's had enough of a base of vegetables in his, earlier years. And I can no longer sneak the broccoli into the mac and cheese. But he is needing to make decisions on his own. And I remember going through that too. So we are very lucky. We set them up in a healthy environment. We have the resources to do that. And I realize that not everyone does, but, I think they're going to make the decisions when their bodies don't respond or adapt as quickly as they age.
Yeah,
to
about 24 years old.
The sugar highs and
realize,
the chemicals.
Yeah.
Yes. I would say definitively, though, highly processed foods, aka Girl Scout cookies, are probably
total garbage.
I don't think we understand the level of potential poison that stuff is.
Yeah.
And
well, that's what I'm saying, though.
I choose my words carefully because I don't want people to, like, I don't want to be inflammatory. But I really think we're going to discover that there
food
are
is inflammatory.
Yes, but I really think that there are some poisons in our processed diet.
Absolutely.
And I eat that shit too.
Yeah, absolutely.
Believe you me. Like,
but that's the thing
good.
Is going back to, like, and I'm kind of joking about the GLP-1, but like I think actually that, like, people, it's like, I just go grab some, gummy worms, or I grab some cookies or whatever.
Yeah.
I drink a soda, and it's not just like
the one time.
It's not just the calories.
Yeah.
It's also like the chemicals you're putting in your body, and the imbalance from a sugar spike, and how you're metabolizing that.
The gut microbiome.
Yeah, everything. And it affects your mood, it affects your energy levels, it affects everything. So I think that part of the, like, what people are seeing with these drugs is that, like, because it's suppressing those, like, quick hit, like,
the brain
snacking things, people are more regulated, they're getting better sleep, their moods are stabilizing. So it's it's interesting. Like, I'm with you on the, like, this is a very new thing, and
just proceed with caution. I know they're monitoring it. It's an FDA approved drug, and it's doctor supervision, blah, blah, blah. I mean, depending on the route, but I don't know. I'm always one who's like, can I do that without a medication? I'd rather do that without a medication, because I've had a couple of bad situations where I'm like, sure, I'll try this med. And I'm like, I'm very sensitive to side effects, and I just don't like how it makes me feel. I'd rather figure out a way to manage the symptoms. Now, don't get me wrong. If I had cancer, like, yes, give me all the poisons to get rid of it.
You don't want a coffee enema?
Probably not. I don't know. Would it feel good?
I don't know. That's what hippies do.
But yes, I think for some of the lifestyle factor things, we can make choices in order to remediate. It just takes more work. But I will support you if you decide to go that route. What I will say, though, for someone who has to go to work and pack her lunch in the morning and has gotten totally sick of what they have in the cafeteria and knows that I should try to avoid processed foods, it really does curb the snacking. And then I have to have very filling, low sugar, 3 square meals. Although I come home and I rummage.
Yeah. I mean, first of all, we're working in the tech industry, so there's always snacks.
Yeah, no, there's
always snacks.
Sometimes there are, and I hate those days.
Yeah.
I'm like, why'd you give me treats?
I do love snacks, though.
I eat them.
Okay, cool. Well, that was a good discussion.
Yeah, it probably went off the rails.
No, it was good. It was good. You have a lot to say on this topic. Yeah. So, tell me something you're still chewing on.
I think I'll always be chewing on this topic. I'm very interested and passionate about health and healthcare and wellness. I think what I'm still chewing on is, like, now that we have built awareness of systems, I kind of feel powerless as a provider, but I think we can all take charge by, knowing what we deserve as humans and treating humankind right. So, it's you deserve healthcare. I think we also need to advocate, as a healthcare provider. It's, funding my organizations, funding my lobbyists, and supporting practice change. And, I think that over time, and voting for the right people, that's what I'm still chewing on. Because, and I've only focused on our own country. I mean, there are some more significant health inequities across the globe, and knowing how well resourced we are, it's kind of a shame. But there are some really good organizations doing some great work out there to try to support that as well. How about you? What are you chewing on? GLP-1 potential?
I don't know, maybe.
All the people who listen to this that are going to be like, what? Girl's so fit.
I mean, I'm somewhat fit.
I mean, for 43, looking pretty
no,
fine, baby.
I think the I don't know, just thinking about the system of healthcare in this country, and it's not just one system, right? It's a lot of systems that come together. Some of them work well.
I didn't even go into big pharma.
Yeah. But I think, there's a big fight right now over like extending the Affordable Care Act, right? Which of course, like the vast majority of Americans want, but the Republicans don't want.
I mean, that is going to bite them in the ass, and they promise they'll discuss it later, but I tell you, no.
Yeah, they won't. They won't for sure.
They're going to run away from it and hide it under the rug like everything else. And I tell you, we can't afford to lose that.
What I will say though is that, whatever happens, like that is not going to solve the problems. Like
even back
letting the cuts happen or saving the Affordable Care Act, either way, there's still massively systemic issues here that need to be addressed. And I think that's what's like discouraging about it, is that like, everyone thinks it's wrong, but nobody's trying to fix it.
Yes.
So to take us home, what do you feel is relatively ordinary about the situation?
I think everyone worries about their health. I think it's a priority of people who may be not healthy, right? More so than, people who are, right? It's a life priority, and it's easy to overlook when you have so many other necessities in life and the pace of things, stress, other fires to put out, and it's a lot to juggle. But I think it's relatively ordinary to be concerned about your health, and I think people have more awareness and an ability to grow that awareness than maybe we give them credit for sometimes. I don't know. That feels relatively ordinary. That's just, again, I'm thinking of myself, right? But I can extend that to others. And as I've, talked to people and all that, I think people know what they need, and they're aware of what their needs are. It's just there's so many barriers, and it can be hard to navigate.
Yeah.
That's relatively ordinary.
Yep. I agree. All right.
Okay, cool.
That's the show.
That's a
all
wrap.
we got.
Oh man, you just opened up a topic that I could go on and on about.
I know. I know.
It was fun. I enjoyed it.
Yeah,
nice
good
work.
stuff.